And we have a guest today who's been with us before, Dr. Patel, and we welcome you again and Happy New Year to you.
Happy New Year.
Dr. Patel has received a number of questions from our staff, but also locally from the community with regard to Omicron, and so we thought that we would share with you some updates on that and then go over a few things about our policy. Dr. Patel, can you just tell us the prevalence of Omicron now, both in the United States, but also in Florida?
It has become the most predominant strain both in the U.S. and in Florida, and the estimates currently are anywhere between 73 and 95% of all of the COVID positive cases that we're diagnosing right now are of the Omicron variant.
Wow, that's a big change, isn't it? Well, can you tell us why it has so rapidly become the more prominent strain in the country?
Viruses mutate frequently. That's the key to their survival. They want to make as many copies of itself in the host as they can. Because it's such a rapid process of making copies, they make mistakes, and those mistakes are in turn mutations. Some of those mutations are completely harmless, while others can impact the characteristics of the virus in a negative way. And for Omicron, one of the main features that we're seeing is that it's more transmissible and therefore more contagious.
So that's why we are seeing more cases, but hey, I got vaccinated. I shouldn't be getting this variant. So help us understand why those of us that have been vaccinated and boosted in many instances are still getting the Omicron variant.
Yes, it's really about the speed at which Omicron is replicating. With prior variants, if you've had immunity, whether it's from your vaccine or whether it's from having a previous COVID infection, your immune response was fast enough if you got exposed to COVID again. In other words, your immune system can kick into action quick enough to fight off the virus and stop it in its tracks before it's replicated enough to either A, make you sick, or B, make you contagious. With Omicron, it's the opposite. We're seeing it replicate so quickly after exposure that although you do have an immune response, it's delayed, meaning that you are getting truly infected, and in some cases you're getting sick. But ultimately, you're contagious, and those people who are asymptomatic or mildly symptomatic can still spread it.
So we still have a number of our staff and some of our faculty and many in the community who haven't gotten vaccinated. What's your recommendation to them?
Yeah, the reason why we're still stressing getting your vaccination series or getting boosted is simply because there's a large number of people who are going to have either asymptomatic disease or mild disease, meaning that you may unknowingly and unintentionally spread this to others around you. We're also seeing that there's a large number of individuals who are still developing severe disease. So if you are in contact with somebody who is unvaccinated and you didn't know that you had COVID, you could potentially give them COVID, and that individual, because they're unvaccinated, is more likely to have severe illness, hospitalization, have the risk of dying, and in turn get long COVID syndrome as well.
Well, those are lots of things for us to think about. So what's got you most worried about the Omicron variant?
There's a lot of reports right now about how there's lots of cases of either no symptoms or mild symptoms, and this is a possibility for us to achieve herd immunity if a lot of people get this. Keep in mind, we still have about 30% of individuals out there who have not gotten a single vaccine dose, and Omicron can still cause severe disease in those individuals and can cost them their lives. We can unintentionally spread this and become a public health crisis by ourselves. And so it's really important that we continue to take the right precautions to keep ourselves and those around us safe.
Yeah, I think that's really important for us to remember that because of the rapid spread of Omicron and the significant number of individuals who are getting infected, whether they be vaccinated or not, by virtue of just the increased numbers of patients with COVID, whether they be symptomatic and not hospitalized or hospitalized, it's going to increase the burden on our hospital and potentially increase deaths among those who have comorbid conditions and are at a greater risk if they do get hospitalized or do get the infection. So I really think that we need to be concerned, and what else can we do if we've been vaccinated and or boosted, if it's been appropriate, what else can we do?
Yeah, this comes back to all those lessons that we learned at the beginning of this. What are the good practices for reducing the spread of infection? Things like proper hand hygiene, social distancing, wearing a mask. The reason why we keep stressing wearing a mask and wearing things like eye protection is that viral illnesses are predominantly spread through respiratory droplets. Even when you talk, you are spreading droplets into the air. Harvard researchers have recently said that Omicron particles can stay in the air for up to 3 hours. And so you could have had somebody 3 hours prior to you walking down the hallway who coughed or laughed, and their droplets are still in the air, suspended in the air. And you could be exposed to that. And that's why we're really stressing, if you wear this barrier, that's going to reduce the amount of droplets that you could potentially inhale. And if you wear eye protection, that could potentially come in contact with your eyes and get you infected. It's not taking much Omicron to get us infected.
Staff, if you have questions, please reach out to us, because we know that there's a lot of information out there. There's information that's accurate, there's information that's less accurate, and we just want to make sure that all of the staff are informed.